Hi, welcome to Dr. Hennessy's podcast, part 4. What were you telling me about the fibres as well in the face? That they run differently.
Yeah, so that line of ligaments that I talked about there, where the ligaments are stuck down, behind that line, the fibres of your muscles are vertical. In front of that line, they're more sort of oblique and horizontal. So when you feel behind that line and you stretch, I'm going to make it really simple, but you stretch the skin this way, the fibres are going to go like that because they're vertical. So as you fill outwards, that's where the lift comes, because you're doing that with the fibres. At the front, it's not quite the same because the fibres are not vertical. They're like that. So hence in front of that line, you're going to get more volumizing and not that lift. Does that make sense?
Yeah, it does. But surely even when you fill it and the fibres are going down this way, they're still going to come out.
Oh, yes, slightly. And that's why you're going to slight lift of the jowls, because you're going to get that sort of a lift. But it's not as dramatic because of that inclination of the fibres. There's more of a vertical inclination there to give it more of a vertical lift.
Is that why the lateral cheeks? Oh, you're not going that far back, actually. They're coming forward, really, aren't they?
Yeah, you're not going quite back there, but you can. No, you can. One of the injections will be a little bit behind that line of ligaments, that will give you a bit of lift.
Okay, so then I keep seeing on social media about having temples filled, and then some people are having.
They look over the
Yeah, and they're like losing this bit.
Yeah.
And
temples is great if you're hollow. I mean, it's again getting back to that sort of athletic woman who's become too gaunt is the word, and the temples go really hollow. Then yeah, it suits people to have that restored.
Okay.
But I think there's a tendency a little bit now, because people get carried away. Well, filling the temples is going to lift the face again. You hear this all the time. So they're now overfilling the temples in order to lift, and it looks strange.
It's straight, and there's no.
Yeah.
I don't think there's any femininity.
Yeah.
Yeah, got that out. Where you have to have the curve and it defines it more.
It's finding that nice compromise, isn't it? Because you don't want hollow cheek, that looks too severe. But you also don't want full, no cheekbone and then going down there. You've got to have that slight contour. It's called the OG curve. You don't need to know that, do you? But when you look at a face from the side, it should have that slight sort of S shape, and that's the sort of beautification line that you aim for. But you might lose some of that if you're overfilling the temple.
That won't happen with me, will it?
Will it help?
No.
It takes a lot to fill the temple. You're not having that much.
No.
Maybe one side. One temple this year.
You'll do this just this side
for
me. Yeah. So, talking about the different things you can do apart from filler, the big one as well is retinol.
Yeah, massive. So I know it's in a lot of skincare, and I know we love our Abage. We've trialed it all, haven't we? I went through all the different ones. I know you've trialed it with me, and we've settled on our ZO. Because it's medical grade stuff, so it's been clinically proven to work. And one of those main ingredients is retinol, definitely. So retinol will help improve the cell turnover. So in other words, you're going to shed all the dead cells, get new cells. It produces more collagen, so your pores will shrink. You get a reduction in those sort of red spider veins. Skin texture improves. Everything improves with retinol. It's brilliant stuff. Brilliant stuff.
How long? So I'm on it and I do it. I can't have it every night.
No,
because it's just too much for me. Even a lower dose. I do every 2 days.
Yeah.
But how long do you think it takes? Does it take the 6 weeks of the?
Yeah. Oh yeah, I did listen. 6 weeks is your skin.
This is the most I've ever listened to you.
6 weeks is your skin cycle, isn't it? So people will want to put a cream on and want to look amazing the next day. Well, okay, there'll be some hydrating effects and short-term effects, but it takes 6 weeks for a skincare regime to work. Retinol is really interesting because you do break it down to 3 6-week blocks. In other words, for the first 6 weeks, you've got to say to the patient, you're going to get redness, you're going to get peeling, it looks irritated, you're going to be annoyed, but that's it working. The next 6 weeks, you're kind of going, oh, that's a bit better. I was looking all right. The next 6 weeks, oh God, my skin's amazing. You have to have those 6-week cycles, unfortunately. A lot of people drop off during that first 6 weeks. Well, we do say back down a little bit. Yeah, have a day off. Don't keep going and going so you're peeling and everything else. But you've got to expect a little bit of dryness and a little bit of that. Otherwise, it's really probably not doing an awful lot. So you have those 3 6-week cycles because your skin cells are working as they should do. You're getting rid of the dead cells. Your new cells are coming to the fore, so they're sort of reproducing quicker. So you're getting rid of the old and you're in with the new. In a nutshell, that's basically what's happening. And that's literally it. So you have to get rid of those dead skin cells. And what's also important as well is an exfoliant. Now, I prefer chemical exfoliants. I mean, ZO, I keep going, but I do love that brand. They do a brilliant one, which means you're getting rid of those dead skin cells. Because don't forget, the retinol is producing all these lovely new skin cells raring to come to the surface. If you're not exfoliating, all those dead skin cells are still hanging around. You've got to get rid of the dead skin, let the new skin come to the fore. So your two main ingredients, I would reckon, it really, if you had nothing else, is a retinol and then your chemical exfoliant.
So you're saying chemical, and I'm thinking you're going against like a grain, or is that
No, so okay, physical and, yeah, so physical and chemical mainly based on glycolic acid, lactic acid, things like that. So they will break the bonds between the cells and let the cells fall off. Your physical exfoliants are the scrubs. Now there's a lot of decent scrubs out there, but then there's also a lot of scrubs that are a bit too harsh.
Okay.
So people are backing off a little bit from the harsher scrubs, which can sort of scratch the skin surface. But that would be a physical exfoliant where you're physically scrubbing it off. But your chemical exfoliants are more gentle.
So you've told me to use a separate retinol, but I see that sometimes there's a retinol in a moisturizing.
Yeah, okay. Well, one of the best things, I think you may have listened to me again for this, possibly, was the retinol. Maybe you will have done, because it was about you. The retinol sandwich. So if you're getting too much dryness and redness and irritation by the retinol, you put your moisturizer on, then your retinol, and then another moisturizer. And that
moisturizer, retinol, moisturizer. You did tell me this.
Yeah, so retinol sandwich, and that helps the skin tolerate the retinol, and so you don't give up on the retinol. Too many people give up on the retinols in that first 6 weeks. Go with it for that first 6 weeks. Try tips like that and go through that first 6 weeks, and then your skin will adapt, because that's the 6-week cycle.
Okay, here's a weird one. So if I'm only ever doing it every 2 or 3 days and not every night in that 6-week cycle, does it mean that it's not working as much?
No, it's still doing its trick. You'll still be fine. And the other thing I was going to say is you will find as we age that skin cycle slightly becomes longer, so it can be sort of 6 to 8 weeks. So we're saying sort of 6 weeks is the sort of the biological, but don't get hung up on exactly the 6 weeks, like to the minute. What I'm saying is you go for 6 to 8 weeks using it. Yep. You use it every other day, is absolutely fine. It's still doing its stuff. It's still stimulating the cells. It can be too much. Your skin adapts to retinol massively. Your skin adapts to retinol. And what you'll actually find is you have to go and increase the strength of the retinol, because you will adapt to that retinol and you'll think it's not doing much. Then we increase, so we step it up.
Thanks for watching us. If there's anything you would like us to cover or any other information, just leave it in the comments or message us and we will do it for you.